Longevity Center, and we're here to talk about heat stroke, and she really focuses on seniors there, and we know that they're even more susceptible to this heat that's coming.
That's right, Melinda.
Yeah.
Good morning, and
Good
thanks
morning.
For having me back. You know, our elderly and our seniors are a very frail population, and heat exhaustion and heat stroke can be very dangerous. And this hot weather, although we don't have it yet, but it's coming,
we know it is.
It can be very dangerous for them. In fact, there's been a recent study done by the University of Chicago stating that 40% of the fatalities that were caused by heat exhaustion or heat stroke were seen in patients over age of 65. So, you know, all the more that we need to be careful about our elderly population because they are more vulnerable. They are unable to, or their body is not able to determine the rise in body temperature like you are when you're younger. These folks may be suffering from other comorbidities or medical problems, which further impairs their ability to tolerate high temperatures. And then they could be on medications like diuretics, which causes them to lose fluid volume, get volume depleted, and then they're dehydrated. So they're more at risk of suffering from heat exhaustion and heat stroke.
Yeah, we all need to pay attention to our bodies in the heat, but especially seniors.
Especially seniors.
Yeah.
You know, any extreme of ages you worry about because they're not able to cope with that as much as we are and sense it.
Gotcha. Let's talk about what to look for. What things start happening when you know you're getting close to a heat stroke?
Some of the signs and symptoms that we need to be aware of and know and pay attention to is, of course, your body temperature rises. So your core body temperature will go up. In heat stroke, it'll go up even up to 105 degrees Fahrenheit. Wow. So if you feel like your body's heating up, or if you notice somebody's really, really hot, their skin will become dry, red, itchy, shallow, fast breathing, fast heart rate. You know, initially you may feel tired, fatigue, cramping muscles, nausea, vomiting, fainting, a throbbing headache, you know, even altered mental status and confusion, dizziness, passing out.
Right. Yeah. So obviously get them cool. Is there anything else we can do right away that would help?
Yes. I mean, you want to obviously remove yourself from being hot, and you want to cool your body temperature. You know, lukewarm water, mist under a fan helps cool your body down. But in order to prevent it, Melinda, we need to, you know, make sure that we are preventing it by keeping ourselves hydrated for once. Water is good for everything, and you know, so make sure that even when you're not thirsty, you're drinking water. You're not just saying, well, you know, I'm not thirsty, so I'll be fine. Should drink plenty of water and avoid caffeinated drinks and alcohol because they serve as a diuretic, and you end up losing more water than drinking water. So that kind of liquid is not helpful. Secondly, you want to wear the appropriate clothing. You know, you don't want to be, there's an old Swedish saying that there's no bad weather, there's just bad clothes. So you prepare for it.
I like that.
You know, you wear light clothing, light colored clothing, and
loose fitting,
yes, and wear a big hat if it's hot to protect your skin from, you know, skin damage. And then stay in cool places. If you have no air conditioning at home, seek out places like the mall, the library, or other places. I don't know if our community has made arrangements for those who may not have air conditioning or ways to keep their homes cool in the hot weather. And when it gets really hot, keep up with the weather forecast as well. And you would know this better, the heat index.
Right.
You know, when it's humid and hot, you actually feel hot more, and you need to keep up with what the heat index is going to be rather than only temperatures as well.
When 90 feels more like 96, that's when you need to pay
attention. Listen to Melinda.
Well, listen to Dr. Shah and the weather reports, and we need to put up the information for Dr. Shah as well at CHI St. Vincent there with the geriatrics, but you can also give them a call about any questions you have, and they can certainly find you the right doctor that can answer your questions, and check on the elderly for sure so that we can make sure they have a good, safe summer. Thank you.